As you know, many people think that health is more valuable than wealth, but the stark reality is you also need to have enough money before you enjoy your good health, especially during your retirement. The good news is that you don't have to choose. You can have the best of both worlds if you plan early enough.
I think when you are young, you don't really think that you need. Why do you want to pay like a few $100s on medical insurance, right? But these are things that at some point of time, health spirals out of control, then what do you do? We really do encourage that our needs change with time. It's important for us to have those regular conversations. And when I say regular, I would say like annual is a good practice. Annual review with your trusted advisor. Take into consideration what your evolving needs are, and have that set a plan and try to stick to that plan. Again, I say start early and start small if needed, but start somewhere. Start somewhere and try to stick to it. I think that's quite essential.
I think data will show that our healthcare cost has gone up almost threefold from 2010 to 2020, and you will projected to increase threefold from 2020 to 2030. That's in 20 years, ninefold increase. All of us need to work together, whether in public service or private, to solve this. And part of that is everyone taking responsibility of their health. There's no better way of lowering healthcare costs than to prevent yourself getting sick in the first place. And this starts from very simple things, taking care of your diet, watching out for your time that you take part in physical activities and exercising regularly, good sleep, etc.
I do not want to put my two girls through that same experience that I've gone through if I do not have an adequate coverage, right, in the event that I fall ill. For myself and my wife, we ensure that, we cover ourselves adequately, to make sure that, we do not add on to the stress of the children, really having to grapple with the high cost of living as we know today, and then having to deal with these unplanned costs again, right?
Having some clarity about how your monthly expenses are, I think it's essential. I think the general rule of thumb is 50, 30, 20. 50% of your salary goes towards the essentials like paying for mortgage, paying for your car, tuition and stuff like this. Then 20, 30% goes towards your lifestyle. Once in a while you want to eat out, The balance 20, 30% savings or some form of financial savings plan, endowment plans that helps to grow and compound with time. Because when you start early, the effect of compounding is very real. And when you start early, your runway of time for that little bit to grow, it does grow, because with time, there is time. And so I would say these are important elements. And again, calibrate every year with the advisor. That one is very important. 3 in 5 customers in Singapore are concerned about being diagnosed with an illness in the future. And it's really not a surprise that the number of strokes and diabetes patients is expected to double by 2050. And 1 in 4 may develop cancer in the future. So these are real statistics that one may think that it is quite far down the road. So taking the time to plan for the future and to plan about some of these unexpected events, I think it's necessary for any Singaporean. So this is why we think proper financial planning is critical, which then can help us with adequate healthcare planning as well.